Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. This is another in our series we're calling Conversations from the CoronaVerse. My guest today is Blue Carreker from Citizen Action of New York and the new New York Statewide Paid Leave Coalition. Blue, welcome back to North Country Matters. We're glad you can be with us to discuss the various paid leave laws in operation right now.
Always good to talk with you and have a chance to at least share some information with people in the North Country.
Thank you very much. While there are some municipal sick leave laws in place in New York, the vast majority of the state needs this kind of protection, especially during a public health crisis. Thanks to a lot of really great advocacy work, New York State already has a strong paid family leave law in place before this pandemic. And both New York City and Westchester County had paid sick days. But now the state and federal government have both responded to the COVID-19 emergency with paid sick leave laws. I expect that many people, employers and employees alike, are confused about what laws take precedent and what benefits are actually required. Can you give us some help in figuring that out?
Yeah, and you're right. It is quite a maze of legislation. Everybody trying to do the right thing, but then the rest of us have to sort that out. And the fact is that neither the state nor the federal government have really had a lot of time or resources to provide education about the laws. So outreach is largely being done by advocacy groups. That's why programs like this, Donna, are so important. So I hope I can help and shed some light on them.
I'm absolutely convinced that you can, because I've heard you speak about this before, and so I think we're in good hands, Blue. Thank you. So first, let's talk about paid sick leave, which is available to those who have tested positive for COVID-19 or who have symptoms for COVID-19 and may or may not still be waiting to be tested, and those who have been exposed to someone who has COVID-19. Most of the workers impacted in these ways have the right to paid sick leave through either state or federal laws, don't they?
That's right. That's right. And I know we've been quite frustrated with some of the gaps in the federal law, but there is a state law here as a backup. And if you are a public worker, or if you work for an employer with between 50 and 500 workers, and that's a lot of workers, then you are entitled to 80 hours of paid sick leave at full pay. That's up to $511 per day, but most people would fall under that, except those who are highest paid. And under the Federal Families First Coronavirus Response Act. And if you fall under that, you should be paid by your employer in the normal fashion through your paycheck. And your employer can then apply for a tax credit to cover his or her costs for giving you that paid leave. So it's a good program for those it covers, and the law is in effect until the end of this year, December 31st.
What I guess we'll have to hope is that the COVID-19 emergency is over by December 31st, or else Congress is going to have to revisit this in 2021, aren't they?
Oh, yes. Well, they should revisit it anyway.
They
It
should.
shouldn't have taken a pandemic to provide this benefit to workers.
Well, no, and in fact, we're the only first world country in the world that doesn't have this kind of protection for our workers. So this has been maybe a good wake-up call for the federal government. But the problem is, of course, there's a lot of workers who fall outside of this definition, don't they?
Well, yes, the federal bill has some major carve-outs. So for the people it covers, it's very good for the employer and the employee. But due to a lot of intense lobbying from large corporations, the federal bill does not require employers with over 500 employees to provide paid sick days. And the ostensible reason was that employers were already doing this, or they would do so voluntarily, but that hasn't been the case. And millions of frontline workers, those people at the grocery stores, at what are considered essential retail outlets, people cleaning places, lots and lots of workers, food workers, are denied paid sick days because of this.
And they are actually the people, those essential workers are actually the people who are most at risk of getting it, because they can't stay home under laws like New York Pause, can they?
That's right. That's right. It's kind of a crazy situation, and one that we really need to change.
And another problem with the federal law is that not all small businesses are actually covered by this, even if they have under 500 employees, are they?
Right. Well, in the law, the legislature, the Congress tried to give a little leeway, and they said that if you're a business with under 50 employees, you could apply for a waiver if providing this leave would jeopardize your ability to keep your doors open. Um, but then the U.S. Department of Labor said, oh, well, we don't have time or resources to review any waivers, so whatever, if you want to, don't provide it. So a lot of small businesses just decided not to provide it. There's no review.
And of course, what we know is that when a law is required, there's two more really important parts of it, which is the regulations that actually make it operate and the reporting procedures in case somebody isn't operating it. And those are the two missing pieces in this federal law, aren't they?
Exactly. Yep.
So are there other groups and populations that are carved out of the federal law?
Yes. And the most outrageous one is that employers of healthcare workers or emergency responders are allowed to deny paid leave to their employees. And the US Department of Labor again came in and defined healthcare worker in the broadest possible terms. So if you're a person who's a janitor at a company that makes some kind of health related piece of equipment, this could apply to you and you could not get paid sick days because of this.
So we're not actually just talking about folks that work in hospitals or nursing homes or other direct care situations, are we, where they could become in contact with COVID patients. This is folks that have any kind of uh, tangential sort of connection to the healthcare operation.
That's right. So yes, the Republicans in Congress did whatever they could to make as much leeway as possible. So you're solid if you're in that 50 to 500 group and you're not a healthcare worker, but there's a lot of people left out. And at a time in a pandemic, that's not right. That's why it was important that our state step in and fill some of those gaps.
Absolutely right. And as you and I both know, here in New York, a lot of folks who have worked, leaders from the Paid Leave Coalition, worked for the governor's office on New York's emergency COVID-19 paid sick law. And that bill did help to fill some of those federal gaps, didn't it?
Yes, it absolutely did. And that has addressed larger companies are still fall under this. Smaller companies do, but the barrier here is the bill is a bit complicated and it requires you to go through a few hoops, and it's also very restricted to exactly the situations you define. So what it says basically is that you need to be home, unable to work remotely, because you have gotten what's called a precautionary or mandatory order of quarantine or isolation. So that means that somebody in the Department of Health, or if you can't get through the Department of Health, your physician, a medical person has said you have been exposed or you are positive and you must be in isolation and quarantine. So in those cases, then you are provided with leave. Getting the leave, if you're at a large employer, that employer just needs to provide it to you. They have to provide you with 14 days of paid sick days. So it's almost like 80 hours. And then if you're at a smaller employer, and again, I'm not going to go through the details, there's a couple layers here. The employer provides less and less of that paid sick leave, but you then can apply, or the employer can help you apply through their paid family leave or disability insurance carrier. And there's special dispensation, so an expanded access to that paid leave time or disability insurance time to help make up the amount of time that your employer is not providing. So a large employer would provide you with the full 14. mid-size would provide you with 5, and then you'd get the other days from the insurance carrier.
That does sound pretty darn complicated. So I think
Absolutely. At first, people try to figure out what that order is and how to get it. Nobody can get through the Department of Health. That was all a little crazy. We hope they're moving very quickly to a point now where you can just show documentation from your physician, and then you can apply for that order at your Department of Health, but you don't have to wait to get your benefits until they get that to you.
And there is a COVID-19 emergency paid sick leave hotline, which we will put in our show notes so people will have that, and a website with some fact sheets and resource links that we'll also put in the show notes, so that anybody who thinks they may fall under that particular law will have some resources to use. Blue, let's talk about employees who need to leave work to care for a child who is home because of school closures, which is affecting millions of families in New York right now, or if a child or another family member is ill and needs to be cared for. What happens to those folks?
So here we have another patchwork. So the federal bill is more generous in its benefits. That is that the orders that have closed schools in general would apply, and you can get paid sick leave for that. You only get 2/3 of your pay to care for that child who's home with school. If you're in one of those carve-out groups and you have to rely on the state paid sick days law, then it only applies if the school or child care provider was closed because of an exposure to COVID-19. It doesn't. The bill was passed very early on, before the state sent out an order to close all the schools, and it doesn't apply to that general order. So there's a lot more gaps there, and there's definitely some work to be done to fill those gaps.
Yeah, that's for sure, because certainly we finally know as of this last weekend that schools will not be reopening for the rest of this school year. So that means everybody is in the same boat in terms of needing to provide for their children who are at home. And there's a lot of daycares that have also closed or are no longer accepting new children. So that's a huge gap for.
It is, and there's also the gap of people who have to care for other family members because they've lost their caregiver or have made the decision that it's unsafe for their caregiver to come. And it doesn't cover those situations either.
Right, and that, as we know, with the situation in the nursing homes, is just very, very frightening for families to have someone in one of those situations. So, Blue, give us some suggestions about what people can do who really want to do some advocacy in this work, but perhaps don't know the organizations that are working on it. Can you outline some of that for us?
Sure. So there is a very broad group of organizations who have come together in a campaign called Paid Leave for All. And you can Google that Paid Leave for All campaign, and they're just almost every organization you can think of that is concerned with either women's rights, gender justice, worker rights, that has come together to push to fill the gaps in the federal paid leave bills, but also to establish permanent universal access to paid leave for all workers. So that is a very well-organized and important campaign. Here in New York, the New York Statewide Paid Leave Coalition is a coalition of about 60 organizations. And we're a loose coalition. There is no coalition website. People are free to get in contact with myself, and I can share my phone number. It's I'm at 518 in the Albany area, 466-8500, 466-8500. But other organizations are involved besides Citizen Action, the NYCLU, Power New York, A Better Balance, a number of the healthcare unions, many different groups. So there's different ways to plug into that campaign.
Yeah, thank you, Blue. So at least, although we did pass, the legislature did pass the emergency COVID-19 sick law, but then the governor had promised and in fact did through the budget pass a permanent paid sick leave program. So how does that bill work and who is going to be able to have access to it?
Yes, so this is an important thing because eventually we will start more and more people going back to work. And this is the permanent insurance providing most workers in New York State with at least 40 hours of paid sick leave. So the way the law is working, beginning in early October, which is 180 days after the budget passed, workers will start to accrue that leave, 1 hour of leave for every 30 hours that they work. And then beginning on January 1st, they can begin to take that leave. So we won't start January and you have to start accumulating then. Once it goes into effect, you're going to have already accumulated some paid sick days. If you're working 40 hours a week, if you're at a very small company, less than 5 employees, and that's not a profitable company, so the net income is less than $1 million, then you can, the employer will only give you unpaid sick days. But for everybody else, if you're working, if your company is small but is very profitable, and or if you're between 5 and 99 employees, you get 40 hours of paid sick leave. And if you're at a large company with 100 or more employees, you'll get 56 hours of paid sick leave per year. And part-time and hourly workers included. Sick leave can be used both for your own personal needs, for your family's medical needs. It also includes safe time, the right to use paid sick time to address experiences of domestic abuse, sexual assault, sex trafficking. And we're going to be working on the regulations over the next 6 months.
Right, so that by the time that law goes into effect, we really will have a good understanding of how it works. The regulations will be there, and we'll have had more time to do some education for employees and employers about it. The emergency leave laws really came with none of that, and that's what has hampered so many people from taking advantage of them, hasn't it?
Agreed. Yes, absolutely. New York City has had a paid sick days law and a good one in place for quite a few years now. They were ahead of the game, and so they have really been able to address those needs of most of their workers, filling in all those gaps that the other laws haven't. Those of us upstate hadn't been able to do that in time, and so many workers are paying that price.
Well, it's good that we have a good model that's working here inside New York State to use as we develop some of these other, we develop the regulations and reporting, because it's always easier if you don't have to completely break brand new ground, isn't it?
That's right. And we are the 11th state in the country to have paid sick days law.
So that means that there are 11 good models out there that the federal government could look at in order to design a federal program if that was important to our federal legislators.
That's right.
So the New York Civil Liberties Union, NYCLU, has just come out with a new resource that you're pretty excited about. Tell us more about it and what it's based on.
Okay, and so I'm very excited about it. I've been looking for this for a while and trying to pull together some of my own information, but it's great that it's from the NYCLU, because what I've been looking for is information for workers who are heading back to work and concerned about having a healthy workplace and their right to a healthy workplace. So this lays out very clearly what the standards are that employers are bound to. What do they have to provide in order for hand washing, sanitation, cleaning, distancing, exposure, things like that. And then it lays out what your rights are if you don't find that your employer is addressing those requirements. So what are your rights? You have a right to complain? Do you have a right to talk about it to other employees? Do you have a right to talk about it to the press? Do you have a right to not go to work, to organize to change it? What it tells you what your rights are there, what the risks are, how you can get legal, and when you should look for legal advice. It also lays out what should happen and what your employer should do and what you should do if somebody at your work tests positive for COVID-19. And then reviews the paid sick leave laws fairly fairly cleanly, as we now know. It's a complicated thing, but it does lay out those benefits as well. So it's a nice resource.
Yeah, it sounds like it. And of course, one of the things that Governor Cuomo talks about in his daily briefings is wanting to, when New York comes back to work, want to work smarter, work better, and work safer. He certainly talks a lot about the fact that we are in the middle of a public health crisis and we can't go back to old practices because it will simply make the virus flare up again. And so the fact that NYCLU has come up with these standards and with these ideas is very helpful because it will give people a chance to come back to work with a better set of ideas about how to move forward, doesn't it?
It does. And I have to say, I receive lots of calls from people who are considered essential workers and have really challenging work situations.
Yeah, I'm sure that's the case in every part of this state and certainly every part of this country. So as we talked about in the beginning, this is a complicated and a complex set of laws that is a patchwork, as you mentioned. So how does an employer or an employee sort this all out?
Okay, so I think the first thing it's good to remember from an employee standpoint and an employer standpoint is most of the time the paid leave benefits are going to come from the employer to you, and they're going to come to you in your paycheck. All right. So my recommendation to everybody right now is to go to your employer and say, do you have written out, or can you review for me what my rights are to paid sick leave if I am exposed, if I am sick, or if I have somebody at home that's sick? And if your employer is able to explain that and put it out there, great. If they aren't, then seek information. And if they say you're not, then go and seek information to confirm that in fact you're in that one of those groups where your employer is not obliged to provide it. So start with your employer and start before you need it, and start asking those questions. And then use the sites that we are sharing here. So New York State has a good website and hotline that can answer questions. And a number of organizations, A Better Balanced Family Values at Work, Citizen Action, NYCLU have resources as well to help you. I think one thing we didn't cover, and that's important, if you need this, you need to let your employer know right away. If you're needing it to take care of somebody, if you know ahead of time, let them know as soon as you know. If you need to leave because you're sick, within a day, you need to let your employer know and discuss with them what documentation you need and how you're going to get it.
Well, the important thing is that before we had paid sick time and paid sick leave, people went to work sick. And it might be one thing if you had a cold, it's quite something and very different when you have something as highly communicable as COVID-19 or the flu. So this is in the employers, the employees, and the general public's best interest that people do understand what their rights are and that they don't come to work sick, isn't it?
Yes, and that's a big culture change for the United States.
Mm-hmm.
For a long time, and I will say it's also been somewhat gender specific. So men in particular have had a lot of peer pressure to never stay home sick, to push through it and do get the work done no matter what. And women, if they want to succeed, also have had a lot of pressure to just show up. But women also have pressure that if somebody in the family is ill or needs to be taken care of, that they're the ones that needs to leave and take time off. This has caused huge income insecurity for many, many families, for low-wage workers and women in particular. A lack of paid family leave and paid sick leave benefits keeps many people close or in poverty, despite the fact that they're working, because they have to go in and out of the workplace, because people can lose shifts, they can lose jobs, and they lose pay if they have to stay home sick. Or they come to work and then they get others sick, they get the people they work with sick, they get consumers sick, they're more liable to have accidents, they're more liable to delay getting care, which means that their illnesses or injuries get more serious. We have more emergency room visits. We have more spread of things like influenza. So all those things have been well documented now over the last couple decades. We know the real costs of not having paid sick leave, and that has become really obvious now during a pandemic. So no, we can't go back to where we were. We have to move forward, make sure that all workers are encouraged and are able to stay home when they're sick and when their family members need care.
Yeah, that's right. Thank you, Blue. So a lot has been done, particularly here in New York State, to win paid leave programs and healthy workplace rights for workers. But still more work needs to be done, and there are gaps we need to fill. Can you talk a little bit about that?
Yes, I think we have one of the things that's been so clear in this pandemic is that we have an inordinate dependence on quality caregivers, the people who care for our children, the people who care for our elderly relatives, the people who care for those who are disabled, the people who grow our food and harvest our food and deliver our food. All of those people live and work in unacceptable circumstances. We do not provide them with enough pay to support their families. We do not provide them access to essential benefits. We do not ensure that their workplaces are safe and supportive. And that needs to change. Most of these workers are women. Most of them are Black and brown women. And they've been underpaid and undervalued for way too long. So we need to now stand up and say, this is a different world that we need to have, that we need paid leave for all. We need equitable and universal access to quality childcare. We need better pay and working conditions for all caregivers and essential workers, including immigrants.
Thank you. Everything that we're learning about the coronavirus suggests that it will be with us on a permanent basis in one form or another. Development of a vaccine is months away, if it is even possible, which at this point we don't know. So we need to look at this pandemic as a wake-up call on all the things that America has refused to face about healthcare and paid sick leave. Governor Cuomo talks about rebuilding New York smarter and better, but we're not talking about that at the federal level, and it's sorely needed. We have a federal election coming up in November. What should we be looking for in candidates who are serious about making the changes that we need as a country, and by putting public health right smack dab on the front burner again where it needs to be, because it has been, we can't afford to ignore those needs anymore.
No, I think we have an amazing opportunity here to look around and see what is most essential to us. We talk a lot about infrastructure, but we only talk about it in terms of buildings and roads. We don't talk about our social infrastructure, the things that ensure that people can work and have a quality of life, that they can have a balance between family and work, and that we can have an economy that values and supports family and a equitable access to jobs, to living wages, and the things that allow us to thrive. It's not always just about a bottom line and a profit margin. We can have good economy, a thriving economy, if we invest in childcare, if we invest in caregivers. That's a huge number of people who, if they were well paid, would put that money back into our communities and back into our society. We have an opportunity to address a whole new area of green jobs that can employ people and should open up the employment field without gender discrimination and without race discrimination. And clearly we have real problems of homelessness that must be addressed, of income inequality, and of mass incarceration. All those things are going to be challenging, and we need to value the things that give us quality of life.
Thank you, Blue. It's certainly true. I've been interested to read lately that in Europe, the uh, the governments of Europe are talking about rebuilding when they start rebuilding their economies on some of the green economy principles that have been talked about there and here. And that certainly, you're right, it is an opportunity to come back better and stronger and by putting people first. So I think there are lots of great opportunities in this. And sometimes it takes real adversity in order for opportunity to become obvious.
Yeah, very true.
So I appreciate you coming on today. It's always a pleasure to have you as a guest, and we will certainly invite you back. Perhaps even someday we can do a face-to-face meeting instead of
Wouldn't that be
by
fun
Zoom.
again?
But in any case, this technology is great because it allows us to share your expertise with folks, and I do appreciate that. So thanks for coming in.
Thank you.
These
care. Stay well.
conversations are a production of North Country Matters. This show is a civic collaboration between the St. Lawrence County League of Women Voters and the Potsdam Public Library. Please stay safe by following all of the public health recommendations, and remember, our North Country matters.